Good afternoon, everyone. My name is Dr. Jeff Thomas. I am the naturopathic medical doctor here at Northwest Wellness, and I just want to welcome everyone to this afternoon's presentation. What I hope to do here is give you guys a brief opportunity as to see how when I sit down with a patient, what does that experience look like? And I want to give you an example that would be relevant to this time of year just so you can see what the process looks like, how we approach it, and then from a treatment point of view, what some of those recommendations might be. And so as you can see during this time of year, one of the more prevalent causes people are going to be seeking out medical care or missing work or just not really feeling well overall is going to be either a combination of the cold and or the flu. And so what I want to help everybody understand is how do we go ahead and differentiate between these two? How do they present? What are some of the ways in which we can prevent it? What's some of the ways in which we can treat it? And then a few other facts that hopefully by the end of this conversation will help you to feel a bit more empowered and knowledgeable as to how to best manage something like the cold and the flu when it comes about. So with that being said, I want to thank you guys for your attention, and hopefully for the next 20-25 minutes, I'll give you a worthwhile presentation that you'll walk away feeling a little bit more familiar with. So just to start, let's go ahead and define what a cold is, just so we all are on the same page. And so what you can see right here first and foremost is what we're wanting to do is just identify this as a respiratory infection that is viral in nature. Now I mentioned viral because some colds are going to be bacterial and they can certainly change between the two. And so as a result, depending on whether or not they're viral or bacterial, that's going to help us understand how to best treat that. Not all treatment approaches are going to benefit a viral infection as they would a bacterial and vice versa. So it's important that we're able to distinguish between those two when we're wanting to first know what it is and how to appropriately treat it. So these symptoms that you can see in this picture here, why are they? Where are they coming from? Why do we experience them? Basically, in short, one way or another, all of these symptoms that you see are the body's way of trying to rid itself of the virus. So whether it be ejection through sneezing or coughing or even vomiting, for example, this is an example of how the body is trying to expel a particular substance from itself. And let's not forget the other end as well. And so if you're dealing with something like diarrhea, once again, this is your body's way of trying to expel something. Now, what about when we get a fever? What is this all about? The body has this innate wisdom that allows it to know how to appropriately respond to a situation. In the context of a cold, there's messengers that are sent to the brain, and these chemical messengers help the body to understand that for whatever is going on, it needs to raise the internal temperature. If the internal temperature of the body is out of a particular window, it makes it harder for that much harder for the virus to replicate. So when you have a fever, this is actually to your advantage, and this is your body's way of trying to defend itself. Now, obviously, some fevers are going to require additional attention, but within reason, more often than not, this is your body's natural way of trying to deal with something. And how about the word cold? What does that mean? Where does it even come from? Well, it was widely believed before people knew what viruses were causing the illness that the common cold was caused by exposure to cold weather. This is actually a belief that has persisted to this day, which is why we still refer to it as the common cold. But what's important to understand, and I'll go to in a bit more detail later on, is that the cold weather itself does not cause a cold and or the flu. So a viral infection, what are we talking about here, and why is it so important to distinguish as opposed to a bacterial infection? And so here are some examples of some viral infections that you may have heard of: the chickenpox, the flu, and in some cases even the cold. So patients will come in and they'll demand antibiotics. I want an antibiotic. I want to feel better. Well, if it's a viral infection that we're dealing with, what's important to understand is that no antibiotics or antiviral medications can speed up the recovery from the cold. And that's just because if they're viral in nature, this is not the appropriate remedy for that particular presentation. Now, if they're bacterial, then we've got something we can work with should we need to prescribe antibiotics. Examples of bacterial infections include strep throat, sinus infection, and in some cases even urinary tract infections. These particular symptoms, these particular illnesses, we can certainly treat with antibiotics. And what's important to understand is that even though you may start off with a viral infection, they can evolve into a bacterial infection. And so what would be an example of how one would be able to distinguish a viral infection that has progressed over time to a bacterial infection. As you can see by way of example, a persistent runny nose that lasts longer than 2 weeks may be in fact a sinus infection. And so when you sit down, I'm going to ask you questions such as how long have you been dealing with this? Have you noticed any change in the consistency or character of the mucus that's being discharged? And depending on how you answer these questions, that will certainly indicate whether or not we are dealing with a viral or bacterial infection. How do we distinguish between the two? We're going to do a number of different tests. We'll do a throat culture, we'll do a blood sample, we'll even do a urine culture if we're dealing with something along the urinary tract. And that's certainly going to help us be able to distinguish whether or not we're dealing with a virus or a bacterial infection. But please understand, it can be difficult at times and it can take a little bit of time. That doesn't mean we can't provide symptomatic relief, but in the long run, especially if we're considering an antibiotic, it's going to be important that we do know whether or not we're dealing with a bacteria or a virus. So just a little bit of information as to how prevalent the cold really is. And the reason I bring this up is just so from a prevention point of view, you can understand, depending on what time of year it is, when to start ramping up your immune system and when to start being prepared for the fact that lots of other people around you, even despite your best efforts, may not be is apt to practice good hygiene practices, and so as a result they may be getting sick, and if you're being around them, you may in fact get exposed to that as well. So as you can see, it's one of the leading causes of doctor visits and missed days of school, the cold or the flu, and you can see that it's quite common for children to experience these sorts of illnesses a number of times throughout the year, much more so than adults. Now, as it relates to this particular part of the country, you can see that more often than not there tend to be more predominant during the winter months. And so here in Seattle, that's going to be around the months of October to April. And so from a prevention standpoint, it would behoove you during the month of September to really start looking at your immune system and being aware of the fact that if you find yourself getting sick more often than not, or you're already feeling still pretty beat down from the summer or whatever else is going on in your life, it's really going to be a proactive thing on your behalf to really start to examine and assess where you stand from an immune standpoint and what you can do to ramp that up, thereby preventing and minimizing the likelihood of you getting sick, missing days of school and or work, whatever the case may be. So for children, just some more facts. As you can see, depending on the age, that determines how often they get sick. The younger they are, the more sick they tend to be. So why is that? Well, there's a few different things that can certainly predispose children to getting sick more often than not. Whether or not they were vaginally birthed versus the C-section. Children who tend to be born through the vaginal canal get exposed to a whole wealth of flora along the vaginal tract, and as a result, that allows them to have a much more robust immune system. Then there are those who have been breastfed versus bottle-fed. Children who are breastfed tend to have more robust immune systems as well. And so these are just a few things, say if you're thinking about having children or you have children who are at the age of still where they're able to be breastfed, these are some of the advantages to breastfeeding, and so how it can certainly play a part in their overall immune system. So how do these get transmitted? Well, basically, it's going to come in contact with the surface, and depending on the surface and how long it's been on that surface, will determine as to whether or not should you come in contact with that same surface that was left exposed by someone who was carrying the virus or the bacteria, would determine whether or not you actually get that. But you can see just the ways of a few modes are going to be hand-to-hand contact, aerosol, contamination of surfaces, just to name a few. So what are some of the risk factors for catching a cold? As you can see, being around a bunch of people is going to be one of those risk factors, whether it's a daycare or a work environment. Certainly each one of those is going to pose a certain type of risk. Those of you who come in contact with people day in and day out all day, certainly going to increase your risk as well. Sleep is certainly another important thing that you may or may not be aware of, but getting anything less than 7 hours of sleep can certainly minimize your immune system's ability to combat all sorts of illnesses and viruses, and so optimizing your sleep hygiene and duration can certainly be advantageous. Certain sort of mood disorders like depression can certainly dampen the immune system. And then if you're immunocompromised, which means if you're dealing with chronic stress, infection, malnutrition, diabetes, nutritional deficiencies, these are certain things that people don't even know they're experiencing, such as nutritional deficiencies would be a good example. But should you be not getting an adequate intake of vitamins and minerals, not eating enough fruits and vegetables, not drinking enough water, not practicing good stress hygiene practices, these can all be contributing to why you find yourself getting sick more often than not. So when you come in, not only we are going to talk about your symptoms, but we're also going to talk about those aspects of your health as well. We'll even go over your medications. For those people who have been through chemotherapy or organ transplants, or even taking various types of glucocorticoids, these people can known to be immunocompromised. And so what we want to do is take extra precautions to make sure we can help them to minimize the likelihood of them getting sick. To describe a cold and or flu, we would use the word called self-limiting, which means it's going to come and it's going to go. More often than not, what brings people in is the fact that it comes and it sticks around much longer than they're comfortable with, or the severity of their symptoms becomes such that it's really compromising their day-to-day activities of living. But more often than not, here's just a few bits of information to take away on the presentation of the common cold. Generally, your symptoms will peak within about 1 to 3 days, and they'll typically clear at the end of about 2 weeks. Children, as compared to adults, will experience these symptoms much longer. That's to be expected. That's okay. But should they go longer than these days that you can see right here, certainly one of the reasons to bring them into a doctor, as well as the fact that should they present with such severe symptoms that you're definitely concerned, definitely another reason to come on in and speak with your doctor as well as to what's going on and what we can do to help try to shorten the duration and or frequency of what it is that they're dealing with. So those are just going to be a few bits right there that you can work with. So how do we differentiate the flu from the cold? Both are respiratory viruses, or both are going to be respiratory in nature. They're just caused by different viruses. Generally speaking, when you have the flu, you tend to feel just much sicker overall. The symptoms are going to be similar to that of the cold, but they're just going to be a little bit more severe in their presentation. So this picture says it best. As you can see on your right, the gentleman's left, he's going to be experiencing the flu. So much more pains, body aches, bit of a higher temperature as well, lots of muscle pains. That typically is going to be more associated with the flu and not so much of the cold. The temperature is a big one as well. That definitely sticks out quite a bit. That helps one to understand that it is the flu, in fact, that they're dealing with. So what are some of the ways in which we would want to address this? Is there a cure? Let's just start with that. In short, no, there is not. Why is that? Well, there's a bunch of different viruses that are responsible for causing the cold, and every year that tends to evolve to some degree. And so it's very hard to pin it down and say, okay, if we tailor a vaccine, for example, based off of a particular virus, there's no guarantee that the next time that presentation of the cold circulates that it's going to be caused by that same virus, which makes it very difficult to come up with a silver bullet, so to speak, to help treat the situation. So what are some of the over-the-counter conventional treatments? Each one of these is meant to, in short, suppress one of those symptoms that we discussed when we first started. So whether it's sneezing, coughing, a fever, the congestion that one is going to experience, these remedies are meant to suppress that particular symptom. So Tylenol is going to help suppress a fever. Aspirin is going to also help decrease the fever as well as some of the other inflammatory aspects of the cold. Things like Robitussin are going to suppress the cough. And then products like Sudafed, for example, are going to decrease congestion. So am I opposed to these? Am I saying that you shouldn't use these? Absolutely not. I think there's a time and place for conventional treatments. I just think it's worthwhile to be informed when you're choosing to use conventional treatments as to what the pros and the cons are, and then ultimately the decision is yours to make. What's important to understand, though, as it relates to conventional treatments is that none of these medications will prevent or even shorten the length of your cold. They may mitigate them to some extent, but they are not going to prevent. And most of these are going to have side effects, such as drowsiness, dizziness, insomnia, and even in some cases, upset stomach. So if you're taking one of these to feel better, it's important to understand that there is the risk of feeling worse. And so if you're okay with that, then by all means. But once again, just make that decision as an informed individual. So what are some ways as we cross over into a more integrated approach to treating the common cold that we're going to take into consideration? Well, numerous studies have indicated that it's important to really understand a person's stress. Where are their aspects of their stress coming from? How do they manage? How do they cope with it? What's their personality like? Even their attitude and emotions can certainly be contributory to why they find themselves getting sick more often than not, or having a hard time even recovering from being sick. And so, because we all react to stress differently, it's important to sit down and take each individual person's situation into account. So, there's no cookbook approach here, there's no one size fits all. Your treatment, your experience, your medical conversation is going to be reflective of where you are, what you're comfortable with, and where you'd like to go and how you would like to get there. These are all considerations that I take into account when I sit down with my patients to help them understand that I'm willing to meet them where they are, work with what they have to work with. As long as we're not hurting them in any way or facilitating any degree of harm, I will support them to the best of my ability. And so, with that being said, this is why we approach the social aspects, the familial aspects, the biologic, as well as the emotional. All of these play a part in wellness. All of these play a part in health. And so, to some extent, we will talk about each and every one of these. We talked about stress. You've heard about stress a great deal. What is its effect on the immune system, and why does it seem to have an effect? Well, when you experience stress, which can come from a multitude of different things, you woke up late for work suddenly, you forgot to set your clock back, and now you're just running out the door, eating in your car. You get to work and you're just run over by a bunch of other things that just seem to demand your attention all at once. Well, what's going on physiologically when that happens? Well, on top of your kidneys, you have these little glands called adrenal glands, and they secrete what are called corticosteroids. Cortisol is going to be one of them, as well as epinephrine and norepinephrine. And when we have elevated concentrations of these particular elements circulating throughout our system, it dampens the immune system. And so as a result, because it becomes so heavily burdened, it creates a bit of a back door for infections and harmful agents to sneak their way in. And so one of the things that we want to talk about is that if you were chronically exposed to stress, that can certainly predispose you to a whole host of ailments and diseases, but certainly as it relates to your immune system, can definitely dampen your body's ability to defend itself. And so looking at ways to manage that in a healthy way are certainly going to be aspects of our conversation. How do we go about doing that? In a multitude of different ways. What I'd like to say about this list in front of you, though, is don't think of it as all or nothing. You don't necessarily have to do all of these things to get the results that you want. You could even take an a la carte approach. I think some people are much more better suited to have just a very simple plan to help them get to where they want to be. You don't want to walk out of here with a laundry list of supplements or treatment recommendations that are just going to overwhelm you and further cause you to be stressed. That defeats the whole purpose. So we can just start with what feels right for you and work with that and hopefully get you to where we need to be. If that doesn't work, well, then we'll ramp it up a little bit. But once again, the idea is to meet you where you are and to work with what you have to work with. What about nutritional influences? Most definitely what you're eating can certainly play a part in your overall immune status. And so that's something that we're going to talk about as well. What are some aspects of your diet that are certainly going to be dampening the immune system? Well, look at all the different aspects of your diet that consume, to some extent, sugar. And I'm not just talking about sweet things. I'm also talking about refined carbohydrates, pastas, breads, crackers, things of this nature. Fries are definitely going to be another one. All processed fast foods are certainly going to be have sugar to some extent. The consumption of allergic foods, so those foods that you know to be problematic, those foods that can tend to cause aggravation, whether or not you're aware of them or not, is certainly a part of our conversation to be had. But once again, certain foods are certainly going to be dampening your immune system as well. So we may want to talk about that as well as high cholesterol levels in the blood. So looking at what in your diet may be rich in cholesterol and consequently dampening your immune system, we'll certainly talk about. What are some other dietary factors that we can use to optimize your immune status? Well, we can talk about what a whole foods diet looks like. We can talk about the importance of hydration, the positive mental attitude, as well as just a foundational nutraceutical approach to help get you through these months where the weather just tends to be a little bit grayer, a little bit more damp. You tend to be a little bit more stressed as a result as well, just to boost your immune system and give you that gentle nudge that you need to help prevent the likelihood of you getting sick. We'll also talk about breathing and relaxation exercises as well as proper sleep hygiene practices. Exercise, always a good thing to have on board. Definitely, yes, science has said that it can help to reduce the number of respiratory tract infections if you're doing it. But you got to be doing it and you got to be consistent. So we can certainly talk about that as well. But in short, exercise is a great way to prevent yourself from getting the cold. What about vaccinations? Definitely get a lot of questions about this time of year. And so the challenge with vaccinations, at least as it relates to the cold, is that one, there isn't one. And two, there's nothing out there that's going to prevent, even if you got the flu vaccine, that's going to prevent you from getting the common cold. So there's not really a whole lot to say on that other than that as it relates to the cold. When should you go see your doctor? Well, there's a number of different reasons, but I've given you 3 here to think about. Should you find that your oral temperature reaches above 102, come on in. If your symptoms are lasting much longer than you would care for them, come on in as well. We'll consider the possibility of a bacterial infection or something else. And if you're just finding that you're not able to work or function appropriately, we can certainly give you some relief in that regard as well. So, towards the end of our presentation here, what I would like to bring up to you is that there are certain things that we've discussed throughout the course of this, some not, but some tend to be common known or thought of as being truthful throughout the general population. So I'd like to dispel what is a myth and what is actually a fact. So what about number 1, being cold causes a cold? Fact or myth? That is going to be a myth. The weather plays a role in when and how we get sick, but not in the way you might think. You see, humidity levels help airborne droplets whiz throughout the air quicker. The lower the humidity, the more moisture evaporates from the droplet, shrinking it in size so it can stay airborne for longer distances. Cold weather is notoriously dry, which explains why we're more likely to catch a cold while we huddle up inside when temperatures start to drop. This type of air can dry out the mucus lining in our nasal passages. You see, without this protective barrier that traps microbes before they enter the body, we become more vulnerable to infection. So we're weakened by the air we breathe in when it's chilly out, not the chilly weather itself. I know that was a lot to take in, but hopefully some of that stuck enough to at least understand. Number 2, taking vitamin C helps to prevent the common cold. This, as well, is a myth. Even though this particular notion was popularized by a Nobel Prize winning Linus Pauling, in studies where 200 milligrams of vitamin C was taken every day, individuals didn't appear to prevent the cold. But the incidence of colds did decrease. So what does that mean? If you're taking about 200 milligrams a day, it's not going to prevent you from getting cold, but what it will do is prevent the frequency in which you do get this particular illness. Large doses, much larger doses, found that treatment with vitamin C at the first sign of a cold reduced the duration or even the severity of those symptoms. So should you come in and we're looking to take more of a preventative stance, we can talk about what those higher doses would be, especially what they would need to be at the first sign of a cold. And the idea is that should you take it right then and there is going to be, to some extent, a reduction in the duration of the illness or the severity, but take into consideration all the other facets that are going to be discussed as well. If you're taking all the vitamin C that you can, but you're not addressing nutrition, you're not addressing stress and or sleep or diet, how beneficial is it really going to be for you? It's going to be questionable at best. And so to optimize the efficacy of that vitamin C, it's important to take into consideration all the other aspects of your immune status as well. How about number 3? Cold-causing microbes can survive for up to 2 days outside of the body. This is a fact. Rhinoviruses, you see, which cause up to 30 to 50% of these colds, can usually live for 3 hours on your skin or any touchable surface, but can sometimes survive for up to 48 hours. So what are a list of touchable surfaces? Think of doorknobs, computer keyboards, elevator buttons, light switches, shopping carts, toilet paper rolls. All of these surfaces are prime hosts for this particular virus. And all it takes is for someone to have this virus, touch the surface, and for you to touch that within 48 hours to have transmission of this particular virus. So that's certainly something to think about during this time of year. How about number 4? There is a vaccination I can take to prevent getting the cold. This is a myth. With over 200 different strains of the rhinovirus, scientists have yet to design a cure. Number 5, antibiotics cure the common cold. This is a myth. Antibiotics work against bacteria. While most colds are viral in nature, only about 2% of colds are bacterial in nature. And how about number 6? Chicken soup can help relieve a cold. A recent scientific study found that chicken soup may provide relief from the symptoms of the cold. The study concluded that chicken soup helps clear mucus from the bronchial tubes faster and more effectively than any other liquid. It does so because inhaling its warm vapors raises the temperature of the nose and loosens thickened secretions. Additionally, ingredients such as onions, carrots, parsley, mushrooms, parsnips, sage, and thyme are all known to some degree for their medicinal as well as antioxidant properties. So there you go. For free, you have a wonderful chicken noodle soup recipe. So what am I going to talk about next? Just a few products that when you were to come in, that we would probably want to go ahead and use to help address the common cold. So all of these products we want to go ahead and recommend come from a professional line because in my opinion, not all nutraceuticals are created equal. Unfortunately, with the lack of regulation there is out there, it's hard to tell if in fact you buy something, those ingredients are actually going to be in there and that there's not going to be anything else like additives or preservatives or heavy metals. Should there be, even though you may find that this may make the product more cost effective, on the long run, it's actually not doing you any favors and to some extent could be actually harmful depending on the lack of quality that these ingredients have. And so as you can see, the first one is actually going to be a liquid berry extract of sorts, and so it's going to have a whole host of mushrooms in there as well as astragalus. It actually doesn't taste like mushrooms, just so you know. It's got a nice berry flavor to it, and so this is great for kids as well as adults. This is just something this time of year is a great daily that you could be taking. You could just take the drops straight in your mouth or you could dilute it in water as well. Either way, this is a wonderful product and certainly something that I recommend for my patients to take when they're finding themselves wanting to just keep a strong immune system. The next one is called alisalin, and this is garlic. Now, you could be bold enough to chew a clove of garlic a day, and that would be awesome. I would certainly advocate for that if you're feeling bold. Otherwise, if you're not really keen on that, you could certainly take it in the capsule form. Garlic is a wonderful 1,000-year-old remedy that's great for antimicrobial, antibacteria. It's just a wonderful whole food that all around has great benefits to it. This throat mist is just a combination of great herbs that help to soothe the throat. What I like about this particular product a lot is that for those people who talk daily for a living and they find that one of the first things to go is their voice and that makes their job incredibly difficult, this is a particular product that I find to be really soothing and help to heal the throat in a much quicker amount of time. So for those people, once again, who have to talk day to day, pardon me, this is a great product. For those people who are looking to have teas as a form of medicine, this is a really great tea that I like. It's warming. It's really just, it's got a nice sort of fall, almost like Christmas quality to it, the way that it's been mixed and prepared. And so this is a great tea to have on hand if you're interested as well. It's got a whole host of different ingredients that you can see right there. All are great for stimulating the immune system. And so for those of you who are interested in having a more one-on-one conversation about this, it would be great to have you in, so please come on by. You have the address right there, as well as the phone number to make an appointment. First office calls tend to be about 60 minutes, and that's just so I get to know you, really talk about all the different aspects of your health. And so we really get a comprehensive analysis as to what it is that you're dealing with, what some of your obstacles to cure may be, and what we could do to support you from either preventing the cold or getting through it as quick as possible. So with that being said, I want to thank you for your time. I hope this webinar has been informative to some extent and you've learned something new. We'll be doing more of these in the future, but in the meantime, I wish you all well and I hope that you have a wonderful afternoon. Thank you so very much.